Hi, I'm Dr. Dean Jones of Denver Spine and Posture Center. If you're watching this video, it's because you're interested in learning a little bit more of a detailed explanation about Advanced Biostructural Correction, or ABC for short. Now, in order to understand ABC, we need to know a little bit more about how bodies work, structurally speaking. So I got the spine to help me out with this demonstration. What we already know about bodies is we got the spine right here, we have the vertebra. These bones here can actually get knocked into all sorts of different positions, right? I'll give you guys an example here. The vertebra can go forward, backwards, it can go to the side, it can actually rotate to the left or right, it can bend forward, backwards, and it can actually laterally bend too as well. Our bodies have muscles that attach all sorts of different directions on the vertebra, and our bodies can actually self-correct the majorities of misalignments. So for example, if this vertebra here gets knocked to the side, your body has a muscle that attaches to the side that can self-correct that, and the same thing happens if the vertebra goes to the right. If the vertebra gets knocked backwards, your body has a muscle that attaches to the front of the vertebra, and it actually goes to the back of the ribs, and it can actually self-correct that. What's been discovered, which is more monumental than you can possibly imagine right now, is that when a vertebra in the spine gets knocked forward, the body cannot self-correct it because we simply don't have a muscle that attaches to the back of the spine, or a combination of muscles that attaches to the back of the spine that's capable of pulling backwards. So I'm going to repeat that. When a vertebra in the spine gets knocked forward, the body cannot self-correct it because we don't have a muscle capable of pulling backwards. Now, we all can remember as a kid our mom and dad telling us to sit up straight, and for the most part, most people would agree that posture is one of the most important things for good health. But why? Why is posture so important? Why is our body doing everything and anything in order to keep our body upright as best that it can? What's been figured out is when bodies are forward, because that's what will happen when that vertebra gets knocked forward, is that'll actually increase tension on the brainstem because it literally increases the distance from the top to the bottom of the spinal column. So our bodies are trying to compensate to keep us upright, but it can't pull backwards. So that compensation process is where the body will actually pull bones out of place into a position it could self-correct, but doesn't, because it needs it there as part of a compensation pattern. Now I'll give you guys some common examples that you guys can probably think with. We've all seen that person that walks with their butt sticking out and their low back a little bit more swayed like that. Well, how did that swayed back come to be? Because at some point they didn't have that swayed back. Well, we got a body that's forward and the body's trying to get it to go back upright. So you got muscles that run up and down the spine that they're called their paraspinal muscles, and they pull, guess what? Up and down. So those muscles here will actually torque and pull the spine in an attempt to bring the body upright. That's one very common compensation pattern. Another common pattern is when the body's forward, the body will actually twist and torque the spine laterally. Here, let me show you guys from this view. We got this spine here that's forward, and the body will twist and torque it that way. And if the body does that enough, that's a condition that we may have heard of before called scoliosis. And ABC actually corrects scoliosis because that's the actual cause of scoliosis. And with ABC, since we're treating the primaries and ignoring the compensations, we're actually able to not only treat conditions like scoliosis, but just about any other musculoskeletal related condition that's not related to cancer, diabetes, infection, or fracture.